Hi everyone, I've decided to put this short video together as I'm aware there's a lot of you out there that might be suffering from shortness of breath at the moment, whether that's from a long-term respiratory condition, symptoms from the coronavirus at the moment, or maybe even some anxiety-related symptoms. What we would always say is if you are experiencing shortness of breath and this is a new symptom for you that could be quite concerning, always seek medical advice either from your GP or the 111 online system just to get some advice on any new symptoms. What we're going to do today is just go through in this short video some positions of ease that might help ease your shortness of breath, but also some nice breathing techniques to try and slow your breathing down. So if we go through the positions of ease to start with, there's two main ones to try and reduce your shortness of breath. The main one is to sit back within an armchair or a dining room chair if you've got one. If you've got arms on the chair, try and relax your arms down by your sides. And if you haven't, you can either have them supported on your knee or with a couple of pillows to lift them up slightly. Once you're here, just try and make sure that those shoulders are relaxed as much as you can and that your feet are firmly flat on the floor. If you don't get any relief from this position, some people find that leaning forwards onto a table so that you can just allow your diaphragm to drop a little bit, and having your arms on the table also helps splints open the airways. So it may be useful to try this position if you don't find sitting upright is comfortable for you. Once you're in either of these positions, we can go through some breathing techniques for you just to try and reduce that shortness of breath down. So once you're in a position where you're feeling comfortable, we'd really want to try and focus on your breathing pattern. And to do that, we would advise to put one hand on your stomach and one hand on your chest. So we can really focus on trying to get some really nice, what we call abdominal breathing. When we're focusing on your breathing, we would advise you to breathe in through your nose and out through your mouth. There's two main reasons for this. Firstly, breathing in through your nose gives you a little more of an effective and deeper breath in. The second reason is they have nasal hairs within the nasal cannula. These nasal hairs warm the air and they also humidify it, which makes it less of a sharper breath to take in. So it actually makes it a bit more comfortable to breathe. So we think about breathing in through your nose and if you can out through your mouth. Some people find it more comfortable to breathe in through their nose and out through their nose, and that's also fine, whichever you feel more comfortable for you. Once you've got that nice breathing pattern of breathing in through your nose and out through your mouth, we'd then be focusing on what your hands are doing. And as you breathe in, what you're wanting to find is that the hand that's on your abdomen or on your tummy is moving outwards and back in again, a bit like a balloon expanding. So as you take a nice breath in, the top hand shouldn't move, it's the bottom hand that moves out. And as you breathe out, that bottom hand would move in. As you can see there, my bottom hand is moving, but the top hand is staying still. We would advise just to try and practice that a couple of times, really focusing on that abdominal breathing. And once you feel like you've got that pattern, you can then start to think about slowing those breaths down. What you're aiming to do is take one breath in through your nose for 1 second and out for 2 seconds. Try not to force the breaths. Wait until you naturally feel like you need to take a breath again, and then take one breath in and out. Always trying to make the breath out slightly longer than the breath in. So as I said, you can do that in this position, or if you're feeling more comfortable, you can do it over the table or even with your hands just supported on your knees. Hopefully, after a few minutes or so, you should start to feel some relief from that shortness of breath. So even just the position of ease might start to ease those shortness of breath symptoms, or that combined with the breathing control should help. Hopefully you can get some relief from that. If you're still struggling with symptoms and you're finding it difficult to manage them, as said before, please seek medical advice or even seek advice from your physio. We're always here to help.